Welcome to the KCMPA ACO Staff Training Module, What is Diabetes? The objectives of this session are to help you understand diabetes and what causes it, learn how diabetes is treated and the goals of treatment, list several risk factors for developing diabetes, and understand the importance of blood glucose control. According to the American Diabetes Association, diabetes is defined as a group of diseases characterized by high blood glucose levels that result from defects in the body's ability to produce and/or use insulin. The types of diabetes include type 1, type 2, and gestational diabetes. In order to understand diabetes, it's helpful to review normal glucose metabolism. Glucose is the main sugar found in the blood and the body's main source of energy. It's also called blood sugar. There are two main sources of glucose in our blood: food and the liver. Foods that contain carbohydrate raise blood glucose levels the most. Our liver is able to produce glucose from other sources, a process called gluconeogenesis. It also stores glucose to help maintain blood sugar levels when we're not eating. It's the main source of blood sugar between meals and at night. Insulin is a hormone produced by the pancreas. It acts like a key to unlock a doorway into the body's cells. Insulin is needed to move glucose out of the bloodstream and into the cells so it can be used for energy. In people without diabetes, the pancreas releases the right amount of insulin at the right time to keep glucose levels in a healthy range. In people with diabetes, glucose is not metabolized normally and begins to build up in the bloodstream, causing hyperglycemia or high blood sugar. There are several reasons why glucose builds up in the blood. 1. The cells can't use insulin well due to insulin resistance. 2. The pancreas does not make enough insulin to control blood sugars. 3. The liver releases too much glucose when it's not needed. Some of the symptoms of high blood sugar are frequent urination, increased thirst or hunger, extreme fatigue, frequent infections, slow wound healing, blurry vision, sexual dysfunction, numbness and tingling in the hands or feet, or extreme weight loss. However, some people with type 2 diabetes may not have symptoms at all, or the symptoms may be so mild that they don't notice them. This is the reason people with type 2 may have diabetes for many years before it's diagnosed. Early detection and treatment of diabetes is important because it can decrease the risk of developing diabetes complications. Uncontrolled diabetes often leads to serious health problems. This is because high blood glucose over time can damage the blood vessels. Damage to large blood vessels may lead to macrovascular complications like heart disease, stroke, and amputations of the foot and leg. Damage to small blood vessels may lead to microvascular complications like blindness or retinopathy, kidney failure or nephropathy, and nerve damage or neuropathy. Type 1 diabetes is the least common form of diabetes. It was formerly known as juvenile diabetes because it usually develops in children and young adults. However, onset can occur at any age. People with type 1 do not make insulin because the insulin-producing beta cells in the pancreas have been damaged or destroyed. It usually occurs when an autoimmune reaction attacks and destroys the beta cells, but there can be other causes like surgical removal of the pancreas. There is no cure for type 1. However, it can be treated by supplying the body with insulin by injections or an insulin pump. Type 2 diabetes is the most common form of diabetes. About 90 to 95% of people with diabetes have type 2. It was formerly called adult onset diabetes because it is more common in adults over the age of 40. However, in recent years it's been increasing in children and young adults. Type 2 diabetes develops when the body cannot use insulin properly. This problem is often referred to as insulin resistance. People who have insulin resistance require more insulin to control blood sugars, which means the pancreas has to work harder to keep blood glucose levels in normal range. The extra demand on the pancreas to make more insulin often causes it to wear down and make less insulin over time. Diet, exercise, and weight loss can help reduce insulin resistance. Medications and insulin can help the body use insulin better or increase insulin levels in people who do not make enough on their own. Gestational diabetes is a type of diabetes that occurs only during pregnancy, usually around the 24th to 28th week. However, it may develop earlier in some women. Gestational diabetes occurs because pregnancy hormones block the action of insulin. This greatly increases the amount of insulin needed to keep blood glucose levels under control. Some women aren't able to keep up with the demand for extra insulin, which results in high blood sugars. Gestational diabetes usually goes away after the baby is born. However, women who have it are at greater risk for developing type 2 diabetes later on. It's treated with diet, exercise, and sometimes insulin. Risk factors for developing type 2 diabetes are a family history of type 2, being overweight or obese, a lack of physical activity, being over the age of 40. There's a higher risk if you're over the age of 65. A history of gestational diabetes, being a member of certain ethnic groups, a diet high in fat and low in plant foods, steroid use, and the diagnosis of metabolic syndrome, impaired glucose tolerance, or prediabetes. Insulin resistance, which is the body's inability to respond to and use insulin, is often linked to certain health problems such as abdominal obesity or having an apple shape, hypertension, abnormal blood lipids, and abnormal blood glucose. When someone has 3 or more of these problems, it's sometimes referred to as metabolic syndrome or insulin resistance syndrome. People who are diagnosed with metabolic syndrome or insulin resistance have an increased risk of developing prediabetes, type 2 diabetes, and cardiovascular disease. Prediabetes is a condition in which blood sugars are higher than normal, but not high enough to be diagnosed with diabetes. It's sometimes referred to as impaired glucose tolerance, which is high blood sugar after eating, or impaired fasting glucose, which is high blood sugar before eating. Most people go through a period of prediabetes before they develop type 2 diabetes. It's thought that both prediabetes and type 2 diabetes start with the problem of insulin resistance. This graph illustrates the progressive nature of type 2 diabetes. Insulin resistance usually occurs first. As the body becomes more insulin resistant, the pancreas will try to compensate by secreting more insulin. At this stage, the top graph shows that blood sugars are still mostly normal. However, over time, the pancreas can't keep up with the increased demand for insulin and eventually begins to wear down, causing a decrease in insulin secretion. When this occurs, blood sugar levels begin to go up. As the rate of obesity in the United States increases, so does the prevalence of type 2 diabetes. About 26 million people in the U.S. have diabetes, which is about 8% of our population. About 7 million people with diabetes don't know they have it, which is a concern because the longer diabetes remains untreated, the more likely people are to develop complications. The number of people with prediabetes is triple that of diabetes, and if action is not taken to prevent it, they will likely develop type 2 diabetes in the near future. It's important to inform patients that simple lifestyle changes are an effective way to reduce insulin resistance and help prevent diabetes. A research study called the Diabetes Prevention Program found that people who had prediabetes or who were at very high risk for developing diabetes could prevent it with weight loss, exercise, and healthy eating habits. The guidelines from the Diabetes Prevention Program include to get at least 30 minutes per day or 150 minutes per week of walking or other physical activity, Aim for about 7% of weight loss, which is about 15 to 20 pounds for most people. And eat a healthy diet with less fat, especially solid fats, more fruits and vegetables and whole grains, and lean protein. The American Diabetes Association recommends testing for type 2 diabetes in people who are overweight, which is a BMI over 25, and have one or more risk factors for diabetes. In those without risk factors, testing should begin at 45, and if normal, it should be repeated every 3 years. Diabetes can be diagnosed in several ways. The most common are the fasting plasma glucose and A1C lab tests. One or both of these tests may be performed. The fasting plasma glucose is preferred for non-pregnant adults and children. The 2-hour oral glucose tolerance test may be performed when the fasting plasma glucose is abnormal to better define diabetes. Fasting blood glucose of less than 100 is normal, between 100 and 125 is prediabetes, and 126 or above is diabetes. A 2-hour glucose tolerance test of less than 140 is normal, 140 to 200 is prediabetes, and above 200 is diabetes. An A1C test of less than 5.7 is normal, between 5.7 and 6.4 is prediabetes, and 6.5 or above is diabetes. A random blood sugar over 200 with symptoms is also considered a diagnosis of diabetes. Once diabetes has been diagnosed, it's important to begin treatment to keep blood glucose levels in a healthy range and prevent complications. The treatment for type 2 diabetes usually includes monitoring blood sugar, a meal plan, exercise, and medications if needed. Weight control, stress reduction, and proper timing of food and medication are also helpful. Diabetes education is recommended to help people with diabetes learn these skills that will help them keep their diabetes under control. Uncontrolled diabetes can lead to serious health problems like blindness, kidney disease, nerve damage, amputations, heart attacks, and stroke. The good news is that with proper treatment and diabetes control, we can prevent complications. In people who already have complications, we can often keep them from getting worse. The goals to help prevent diabetes complications include controlling blood sugar, A1C less than 7, controlling blood pressure, less than 140 over 80, controlling cholesterol, especially the LDL, less than 100, include statin therapy if they are at high risk, quit smoking, regular visits to the healthcare provider, regular screenings and early detection for complications, good foot care, regular eye exams, and diabetes education. Prevention is the key. It's important to encourage patients who are at high risk for developing diabetes to take steps to prevent it. In people who already have diabetes, early diagnosis, education, and treatment will help reduce medical costs and help patients lead healthier, more productive lives.